Hi, welcome. Good to see you all. Some familiar faces. Great to anyone who's willing to keep their cameras on. No pressure. Welcome to this talk on World Voice Day. Great to see you all. Thank you for joining us. Let me quickly just introduce myself. I know that some of you already know me, but I'd like to introduce myself to the people that don't know me on this call because we've invited anyone to come and join us, and we're very excited to see you. My name is Sandra Oberoi. I'm right now based in London. I'm the director of Harmony the Music School and Harmony International, and I love what I do because I get to travel around the world listening to different people sing, teaching them about good singing, and really empowering voices of different kinds. So sometimes I work with younger voices, sometimes I work with older voices, sometimes I work with teachers on how to train voices, and that's pretty much my job. I also enjoy singing. I'm a soprano, and I love singing all kinds of genres. So, where I'm coming from with this talk for you all is knowing that we have different kinds of voice users. There are those that are just speakers, voice, you maybe voiceover artists, maybe teachers, or you work in different companies where you use your voice a lot, as well as plenty of singers. So, even as a singer, I'm someone who advocates singing different genres and not just approaching singing through or with one genre. And you'll see that in my talk as well. We'll expand, play some games together, and really understand. Our goal is to keep it simple today. The three of us that are talking, you will hear the medical side when Dr. Shantanu Tandon speaks. He is going to share a little bit more about the voice. You're going to see images. For those of you that have not seen images of the vocal folds, it might be a bit interesting, but well, you need to know how your voice is and what your instrument looks like. And for those that are familiar, this is a sort of a refresher of sorts, right? On World Voice Day, a certain theme is put out there, and this year happens to be caring for our voices. So that's really what our theme is about, and something that perhaps we don't talk about very much. Some of the information is going to surprise you, which is exciting. It's always good to learn new information. Some of the information might disappoint you, especially those who are trying to sing all kinds of songs, singing high, singing loud, etc. But some of the information I believe you can take away and go and use it in your everyday life, and also tell everyone around you, take care of your voice. So that's our theme, taking care of our voices. And I'm going to quickly introduce today. It's such a pleasure, I tell you, such a pleasure to have this absolutely fine medical doctor joining us today, Dr. Shantanu Tandon. I've known him for almost 2 decades, I think.
Yeah.
Yeah, probably about 2 decades. And we've been working together. We actually first met at a voice event many years ago in Bangalore, where he was also presenting, I was also presenting. And then the friendship has continued. If I see any students that come to Harmony, or if I have students who have voice issues, he's my go-to. I would send them to him, and he does a fabulous job doing endoscopies and diagnosing what is wrong, and providing care, talking about that, etc. Dr. Shantanu works at Sakra World Hospital. Really fantastic doctor. The interesting thing is, with ENT specialists and voice or laryngologists, not many of them pay attention to the singing voice. They talk a lot about the speaking voice, but not many of them think about the singing voice. But here's one gentleman who's completely different, and it's just such a privilege to have him join us today. And he's going to dive in and tell us a little more about the voice. Over to you, Dr. Shantanu. Thank you for being here.
Thank you so much, Sandra. Can everyone hear me? Hopefully, yes. So, yeah, as usual, effusive in your praise. Thank you so much. I often talk about voice care professionals, and as Sandra said, I'm Dr. Shantanu Tandon, and I work at Sakra World Hospital. Now, although the screen says professional voice users, but voice users are so many versions of them that we see every now and they use our voice in various ways. Some a little more subtle, some where we just have to talk a lot. But the bottom line is the voice shapes who we are on a day-to-day basis. But why should we talk primarily about voice professionals? And when I say voice professionals, I'm not saying people who go on stage to earn a living only, but amateurs, people who just enjoy using their voice. I would probably club them all together. And the reason why we're taking this perspective, it's more likely that I'm going to pull a hamstring if I'm Virat Kohli or if I'm Roger Federer than if I'm not. And so just the way that we use our vocal cords, which have a muscle inside our voice box, and just how much do we strain our vocal cords? It tells us or it determines who will develop voice problems and therefore it's a little more important for people who are using their vocal cords on a regular basis to pay attention. It's important to understand the problem, right? But to understand the problem, it's also important to understand what happens in our voice box. Now, most of us have heard the term voice box or vocal cords, and we know that vocal cords are these white string-like structures uh, in the lower part of our neck, and well, they move in and out, they vibrate, they create sound. But you would have seen that when you get a bad cold, when you get a nose block, our voice changes. Now, our nose has nothing to do directly with the vocal cords. But the reason why it's important is that when our voice gets created, the sound waves pass through the mouth and the nose. And that's where it resonates. And that gives rise to something called resonance of voice. And therefore, it's important that our resonators, that is the upper part of our airway, is as healthy as our voice box. It's also important that the strength of our voice, the amplitude, is good. Now, the only way that's going to happen is that if there is a good amount of air that is passing from our lungs through our vocal cords, making them vibrate, and then they pass through a healthy nose and throat where it resonates. So the resonators, the vibrators, and the generators are three very, very important parts of how we create our voice. So this is what a vocal cord looks like. Uh, I see about a dozen every day because a very common procedure that we do is a laryngoscopy or endoscopy. And when they open up, you can see the airway in the upper part of in the upper image. And when we are actually trying to say something or speak, our vocal cords come together completely. So one of the most important things that we talk about is are our vocal cords completely closing? And when they close, you see a nice little line in the middle, and this is a perfect vocal cord. So how do we know that we have a voice problem? Now, a lot of times we don't know how to quantify it, and there may be subtle problems. If you have a really bad hoarse voice, you've partied all night, you've gone on in a concert, you've had to talk a lot, your voice really gets bad. But a lot of times there are certain warning signals, signals which tell us that your voice is not too bad, but it might be if you don't really pay attention. So subtle signs which tell us that probably something's not right. Like if you've been talking or singing, especially, you start seeing these pitch breaks. Now, these pitch breaks may happen, maybe not at your fundamental frequency, which is the frequency which is which allows us to speak most comfortably or sing most comfortably. But the minute we're going out of our range, or going at a high pitch or a very low pitch, you start seeing these pitch breaks. You obviously can see change in the voice quality. Sometimes you start feeling that your voice is a little bit, or your neck is a little bit sore, your throat is a little bit sore. Sometimes you're fine if you have to sing, say, for about 5 minutes, but the minute you cross over to, say, the third song, you find that it's a lot more difficult, that you're straining your neck muscles quite a bit. Some people get regular changes in their voice. They say that, Doc, I always lose my voice after, say, a session. And that's not great. It's not ideal, and it's something which needs to be looked into. Some people, they just feel that there's something stuck inside their throat, or they constantly keep clearing their throat like this. Why does this happen? Well, there are some which are very easily understandable. So there are musicians and non-musicians who are either smokers or they're taking alcohol, and that's obviously not good, and everybody understands that. But a lot of times our diet is important. Our diet is important for multiple reasons, but one very, very common thing that we see, uh, more so in adults than in children, is what we call loosely heartburn or acid reflux. And when we think of acid reflux, we think of that burning sensation in the stomach or in our throat. That's not always the case. Sometimes people have what we call silent reflux, and the only symptom you may have is a change in voice and a feeling that something is stuck, which you have to clear your throat like this. And sometimes you might have medications, sometimes you may have, especially in young girls or young women, thyroid problems, which have a tendency to thicken the vocal cords. So, all of these are causes. But I think one of the most important causes in professional voice users is chronic vocal abuse. Now, it's a term which is bandied about quite a bit. It's loosely used, but the short answer is people who either overuse their voice or improperly use their voice are people who are going to develop chronic vocal abuse. Now, a lot of us will first need to understand what is going on. And why that is because there are so many things that can happen. Now, some of these things we can immediately find out. So, subjectively, if your voice is bad or sounding not great, which can either be a speaking voice, but a lot of times when we're working with musicians, we ask them instead of to just say E like that, all we're going to say is, why don't we do a couple of pitch glides, a couple of scales? So, like, why don't we do a and the minute we start hitting extremes of our notes, we start seeing subtle changes. So our eyebrows get furrowed, our neck muscles get tight, and all of these are subtle signs that you're trying to use a set of muscles which are not ideal. But it's always important that we want to make things objectively clear. And although what our voice sounds like is not like a crossword puzzle, you fit in all the dots and you got a perfect word, but there are some basic objective parameters that we often check for, and that's done by using something called a computer voice analysis. We'll select a small clip of their sound and we will break it down into what is the pitch, what is the timbre, what is the variability in some of these parameters, what's the amplitude, so on and so forth. But I think the gold standard to understanding what's going on is obviously doing a laryngoscopy. If you haven't had a laryngoscopy done in the past, this looks a little scary. It's not. It's about 45 seconds where we use different types of cameras to have a look at the vocal cords. And not only does it give us good magnification and lighting, but we can ask them to functionally use the vocal cords while we are observing. The most important part of it is to do something called a video stroboscopy, where we actually look at the vocal cords in slow motion, where we can actually see the vocal cords move like this. And are they moving symmetrically? Are they moving in, they have good periodicity? All of these things are something that we want to see. But unfortunately, in some cases, we'll see various types of lumps and bumps. And yeah, these are images of things that you do not want to see when you are doing a laryngoscopy. It's quite interesting that although these look totally different from each other, 99% of the times, these are all caused by a combination of various vocal abuses or vocal overuse. So the way that it presents, so it's like you could twist your ankle, you could get a sprain, you could get a fracture. They're all because of some form of trauma. Similarly, all of these are some form of what we call phonotrauma. And then sometimes we see an absolutely perfect looking vocal cord, but the voice sounds really weird. Sounds strained. It sounds, that's the kind of sound that we hear. And one of the things that we see is people who are trying to work outside their comfort zone when it comes to pitch and amplitude. They have this strained kind of a facial architecture. Unfortunately, it's more common in the people who sing rock and pop. Uh, but that's just because of the amount of discipline that goes into vocal training versus lack of it in some cases. I may be generalizing a little bit, but it's really important that you understand that if you are singing like this or trying to really strain your facial architecture, that means that you're probably not comfortable doing it. What can we do about it? This slide, if there's anything to take home, it's this slide. Please drink a lot of water because I can't understate the amount of importance that hydration, not just of the whole body, but the vocal cords specifically carry. Just to get a little scientific, this is an MRI scan showing the same vocal cord before and after taking large amounts of water. I don't know how much of this you can appreciate, but the area which is boxed out seems a lot thinner in the left side and on the right side becomes much thicker. So you definitely want things which hydrate your body. So you want to avoid spicy food, fried food, caffeine, alcohol. But performers, they definitely want to avoid sugar and fried food just prior to going on stage or just prior to a long session. This is a voice surgeon or a laryngologist's biggest challenge. Now, I keep talking about how people who have vocal overuse or vocal abuse, they develop voice problems. So, understandably, the first thing that I would tell them to do is stop using their vocal cords so much, right? It's very difficult to explain to amateur as well as professional artists that the next thing that you need to do after you leave my clinic is stop singing, at least for some time. And then you need to gradually start singing in a way which is more, well, correct. So it's like saying that if somebody has a hamstring injury and he's a professional football player, you're going to start by giving it rest, then you're going to start doing some physiotherapy, then you're going to start doing maybe some practice games, and then you're going to start playing hard. I won't get into the specifics of this. You could maybe just take a snapshot and read it, but the bottom line is it's important that breathing, articulation, as well as the way that we use the musculature of our neck and throat are all important. It's also important that you focus on the posture that you're sitting or standing in, preferably standing in when you're singing. I'm sure that Sandra and Tia would probably talk a little more about some of these things. It's important, and some of these are more pertinent to, well, music teachers or teachers of any sort. But how much do you actually talk? Do you actually do warm up or cool down exercises? Do you take adequate rest periods? People who like to sing, but they don't use amplification, it often can trigger a vocal cord problem because you're trying to drown out surrounding sounds while you're trying to reach out to the people or project your voice a little more than that what is safely doable. Okay. A lot of times you don't work in places which have good acoustics. So all of these things, although alone may not be very important, but all together they all start adding up. And the last line that I've kept is primarily for teachers because I often deal with a lot of teachers. So when you're teaching somebody, you want to take short breaks. You don't want to do all the talking because it all kind of adds up. So people who have insight into this problem, they do get regular vocal cord checkups done, and that's something that you should do. But the other thing, especially with professional voice users that I see, is how they just try to convince themselves, either due to commitments or finances or just out of habit, that maybe I could stretch my voice a little bit more. Maybe I can take voice rest after maybe a month or so. I just need to sort out this leg of my show session. So it's important that you listen to your voice and not to your, okay? Again, breathing exercises, a variety of them. I won't get into the specifics of it all. But what you've got to know is that if you don't take care, then although the left side is not what I look like when I go to the operation theater, but I do have to operate on patients who have vocal cord problems every now and then. Now, the good thing is that there are a lot of new advances in the way that surgeries are done for vocal cords. One of the most important things is the edge of the vocal cord. which, well, it's the holy grail. So if you can maintain a perfect edge of the vocal cord, then the vibrations are generally good. And we often do something known as a micro flap surgery, where we actually lift up the outer edge of the vocal cord, remove tissues from below which are not good, and then reposit back the flap. So I won't get into the specifics of all this, but the bottom line is there are situations where you may need a surgery if you don't take care. So if I did have to give you a take home message, it would be water, water, and water. Regular voice rest. So listen to your vocal cords, listen to what you sound like. And although you do want to hit those 2.5 octaves instead of just 1.5, but don't do it while traumatizing your vocal cords and your muscles over there. A lot of times you don't want to do this. I keep saying this. So keep water handy, take sips of water through the day. Use amplification whenever it is possible. Although it is boring, please do warm up and cool down exercises if possible after long sessions. And don't ignore the warning signs. It's important that you listen to your voice because it might just tell you something important. Thank you.
Fantastic
Yes.
talk. You took away some of my points also, so great.
Oops.
No,
Sorry
that's
about that.
great. No, that's fantastic because I'm so glad you said it and people didn't have to hear it from me because coming from the doctor, a medical doctor, you having actually seen all of this, it's so helpful for them to understand because we keep telling our students, we keep telling teachers, well, don't do this and don't do that, but you're looking at it, you're seeing it, you're dealing with it on a daily basis, like you said, seeing 10 to 12 patients every day. And so that really means that this is the reality. And it's so important for us to watch our voices. To add to what Dr. Shantanu Tandon said, the interesting thing is we can't actually feel issues on our voice, on our vocal folds specifically, because it doesn't really have nerve endings, but it's the area around, which is why he said people say, oh, let's just push it a little more. Let me just do that one thing, because we're not feeling it, you see, and we want to just keep going more and more. That's why it's so important to listen to your voice, listen to the sound of what's happening, and all the signs that he mentioned: throat clearing, having to the inability to speak properly. You speak a couple of you just take one phone call and then you find that your voice feels used up at the end of it. These are all signs that shouldn't be ignored. So thank you for joining us. Something else that I'm just piggybacking off what he said: hydration. We think that just before we go on stage, oh, I can drink water and that's going to be sufficient. The funny thing is, when you drink water, it goes for all other functions, right? If you've eaten a big meal, it goes to digest your meal. It goes, if you're studying, students on this call, it goes to into your circulatory system to be used by different other frameworks within your body. And it takes anywhere between 30 minutes to 2 hours for it to actually reach your vocal folds. So you drinking that water just before you go on stage doesn't guarantee that your voice is going to be fine, which is why it's so important to take care of it. I'm going to share my screen and very quickly take us through something. Some of the points may be similar, but I'm going to just feed off of what Dr. Shantanu said. And I'm going to tell us about certain issues that crop up across different ages. So that's pretty much where I'm going with my presentation, and then we'll do some quick exercises so we can take something practical from this session today. Yeah. So I know that there are people of different ages on our call, and as I said to you right at the very beginning, I work with singers of different ages. I don't work as much with younger singers right now at this point in my life because I'm more focused on training teachers who work with singers, or I work with intermediate to advanced voices, or I work with people who have voice issues, or I work with people who, professional singers who want to build their capacity to sing in different styles. That's where I am. So I don't work with a lot of younger child singers, but I'm going to bring to you, from my experience of over 25 odd years, what is happening and what are the issues that we've faced or I faced as a voice teacher and what the science tells us, right? So I'm looking at 3 to 12 years just as a ballpark figure, but something that we see at this time is even children born in a certain environment where parents happen to be louder, use their voices loudly, or parents speak with a bit more with more sort of presence and resonance, usually children in those environments would sound louder or would tend to speak louder. If maybe mom tends to shout and give instructions to a child just learns that ordinarily, sometimes tantrums, whatever it is. But in this particular stage, 3 to about 7, 8 years old, sometimes you can hear these issues. The voice is husky, the voice feels it feels a lot deeper. A little boy wouldn't sound clean and clear. The voice won't be really clear, but it sounds a lot more kind of deeper. So these are signs. It's because of shouting. It could be sports. It could be vocal use, too much of vocal use. How do we remedy this? And I've put here, you see vocal fold edema. Edema simply is another word for swelling. Whenever you use your voice too much, that is, if you've shouted a lot, the vocal folds, I want to say, think about it like this: the folds move in this wave motion, okay? They don't really move typically like a string, but they have this wave motion. They come together, so they're constantly slamming together, if you please, when you're speaking or singing. So speaking, we say phonation when you're speaking or singing, and they're constantly slamming together. So imagine if for about 7 hours a day, that's pretty much how much we chat, right? A lot of us were constantly slamming our hands together. We would have some issues, right? We would have some sort of pain or some sort of swelling. That's what happens to the vocal folds, especially if we're pushing and sort of using too much of pressure on it. So that's vocal fold edemas. Nodules are little bumps that you saw that Dr. Shantanu actually showed us. So avoid shouting. Vocal hygiene education is what he just did at the beginning of this call. He talked about taking care of the voice, hydration, how to speak, getting enough sleep. That's vocal hygiene, the kind of diet you need to have. So telling young children or telling younger people, don't shout. Say this to me exactly as you're saying it, but don't shout. Don't raise your voice. We actually talk with parents and say, this is something that you need to think about. Then you can also do humming games, straw phonation. I'm going to show you this. We'll go through it a little more later. But one of your best friends, along with hydration, is to just get a straw. It's a fun game. You can put it in and just do little glides with the straw. So I'm doing I'm doing that, but I'm doing it in some water here. I put a straw in, and I'm doing a straw, that's called straw phonation. We'll talk about this in just a couple of slides. Now, going on from there, the next stage, that this is a very, very precious stage to me. I did a lot of my master's research was based on this particular age group. Of course, I've the research, the science itself has moved on quite a bit in the last 12 to 15 years, particularly on this stage. Both boys and girls present different kinds of issues. You heard Dr. Shantanu talk about muscle tension dysphonia, and some of the ways you feel it. You feel this pressure, you feel this push, you feel a lot of issues. There's a lot of tightness in the voice. Again, vocal fold edema, nodules, phonatory gaps. It means this can be caused for two reasons, and I'll just tell you in a moment. What is a phonatory gap? It's when you're speaking, hi, hi. It's not clear. You hear little gaps in between. When somebody's talking, you can hear little bits where just air escapes. Now, this can happen because the folds don't completely, new word for some of you, adduct or come together. Or if the folds are, if psychologically the person seems, sometimes psychologically at this age, children or young people tend to be a little more sort of inward. They feel a little more pressure to project or to talk out or whatever. And so as a result, they don't engage in good phonation, and then you hear these phonatory gaps. So some of the causes in this age bracket, again, shouting, singing too loud, too long, too high. How many girls want to sing BTS and Golden? You have younger singers trying to imitate all of this, singing too high, too long, too loud, and that also can cause voice strain. So in this particular stage as well, there's singers who imitate, you want to imitate maybe Mariah Carey, or I don't know, I mean, different singers. You want to sound like someone. What I say to students, find your voice. What is your voice? Who are you? What is your voice capable of? And it's very interesting. Did you know, just like your fingerprint is uniquely yours, your voice print is also something that's uniquely yours. I think it's so special, right? So it's even more so important for us to find our voice at this time instead of trying to imitate and sound like someone else. Something else which is not so much an issue in particularly the Indian population is vaping and smoking, but here in the UK, something that I see, and in the US, a lot of young singers are, they have vocal issues because of vaping and smoking. Children as young as 12, 11, 12, 13, they have issues because of this. How do we remedy this? There's resonance voice therapy. I told you about SOVT, or the straw phonation, semi-occluded vocal tract exercises. Again, we'll talk about it when I come to the exercise slide. Counseling and voice therapy, especially if people are, they feel a bit underconfident about themselves, or they need somebody to speak into them and help them overcome any sort of shyness issues, etc. So that's something else that with voice therapy, counseling also will help. Okay, now going on to the next stage, adults, and this is really broad, so it's people who are working, the working population, depending on the jobs that they are in, as well as people who are women who are experiencing perimenopause, menopause related issues. Literally, it's all these stages just clumped together. Of course, we can break it up, but it's good for us to just know at large what issues are there in this particular age bracket. Dr. Shantanu spoke with us about the laryngopharyngeal reflux or acid reflux, and he said sometimes it doesn't just present itself as you having to feeling the burn or the heartburn. When you wake up in the morning, for example, if you feel like you have to clear your throat, that could be an indication that you've had acid reflux the previous night. Or if you find that your voice, the tone of your voice is changing, that could be a result of the reflux. This was also a good time for me to tell you. You saw in his slide where he said avoid caffeine, for example, and I get asked this question a lot. It's because caffeine is a diuretic. Diuretic is something that flushes out moisture from your body. So alcohol and caffeine, these are things that cause water to be flushed out, or moisture to be flushed out from your body. So again, resonance voice therapy, SOVT exercises, vocal function exercise, these are all specific exercises, and then you sometimes want to be sure that you have a professional dealing with you when they're doing laryngeal massages, etc. So all that you heard in the previous slides and Dr. Shantanu speak about how you take care of it, those are baseline things to think about, but we have also over and above that specific areas that we talk about when we're dealing with voice therapy. Then we're talking about older adults here. Here again, you have sometimes a lot of older adults, or some older adults, have issues with laryngeal reflux, the laryngopharyngeal reflux. They also have muscle tension dysphonia. Something called something else that presents itself is age-related atrophy. That is when the muscle is wearing out just because of age, which is why I say to anyone who's in the older age bracket, use it or lose it. I'm telling you, that can't be more true. If you're not going to use your voice, just like if you know that lifting weights, 50 plus, it's good to lift weights, it's good to build muscle, it's good to keep that muscle going. It's the same principle with the voice. If you don't use it, if you're not going to be doing simple glides, simple exercises, you're going to lose it. Post menopause laryngeal changes are also, again, the voice dries out, and you have you have thinning out of the vocal folds, so it becomes really difficult to speak and sing, which is why you need to build capacity in the voice. The diet is also important. Smoking causes issues in these ages as well, so something to watch out at this time. Now, 10 easy things to remember based on what you've heard so far from Dr. Shantanu Tandon's slides and my slides, what I've talked about. 10 easy things. Pay attention to your voice. Listen if it's hoarse. Listen to voice changes. This is your best indicator, because remember, you can't feel pain necessarily. By the time you feel pain, it's actually gone to all the musculature around. But your vocal folds itself, you can't really feel pain there. And so as a result, you have to be listening for what's happening in your voice. Your lifestyle, exercise more, think about your posture. Okay, think about how you want to don't put yourself in places where you feel that it's you're doing things unnaturally. So think about your posture, think about your diet, hydration. This is your lifestyle. You have to make changes to your lifestyle if you want to be serious about using your voice as a professional voice user or otherwise. Sleep, oh my goodness, when we sleep, our voice heals. It does. When we sleep, and you need to get into deep sleep for oxytocin to be released in your body and heal your voice. There's nothing more beneficial than this, besides, of course, hydration. Please sleep and take rest. Don't do any sort of throat clearing. So one way to sort of sort this out is to do a hard swallow, like a quick hard swallow, hydrate, drink, or hum. Do a light hum if you feel like you want to clear your throat. Hydration, I've said here, dehydration is your vocal enemy. I'm telling you, it's true, because for the vocal folds to function optimally, we need it has to be coated. There's a mucus coating on it. It's called Reinke's fluid, and for this fluid to be replenished, we need to drink water. We need to keep drinking it. But remember, I said when you drink it, in the moment, it's not going to actually reach your vocal folds. So hydration is really, really important. Aim for 6 to 8 glasses a day. Don't whisper. This is again something that many people think, I'm not shouting, so I can whisper. Whispering actually causes that much or more strain to your folds. So if you're sick, don't overuse your voice, and don't strain it. Speak gently, speak softer. If you need to use a microphone, do that and take vocal rests. Don't shout. Number 7, move closer to a person and talk. Those of you who go into loud, noisy environments like clubs or pubs or bars, I feel your pain. It's really, really tough. So move closer when you're talking to people at parties, or when you are even teachers teaching in a classroom. It's difficult. So there you have to build resonance techniques. When I train people, I talk about twangy resonance for teachers, because the frequency carries much better. Don't worry if you don't understand this. It's more hi, hi. You see, it's kind of with a nasal resonance. That's a better, safer place to be than just shouting. Okay, so build resonance techniques. Focus on your breath. Better breath support means more control. Think about breathing lower rather than just breathing upwards like that. Breathe lower, because this breathing upwards when you're singing, sometimes, again, it's dependent on the kind of genre you're singing, but sometimes, especially with Carnatic singers or Hindustani singers, we're seated on the ground and we have our legs folded. It's really difficult to breathe low. So then that has to be actively taught into the lessons, thinking about breathing low, sitting up straight, and you're able to sort of engage your lower abdominal muscles when you're to control the voice. Rest your voice. Something that Dr. Shantanu said as well, you may go on vocal rest and it might mean complete vocal rest, or it could be something known as vocal load. Perhaps you're using your voice a lot during the day, you take calls, or you're a teacher, you teach a lot. When you get home, for lack of a better word, shut up. Shut your mouth, don't speak. Treat your voice like it's a flower. Take care of it, because you've used up your vocal load, you've used up your chips, so to speak, at the beginning of the day. So watch, or try to take breaks in between. 5 minute short breaks even really help. And when it's break, it's not whispering, but it's literally quiet. So sometimes I tell some people, don't speak if you've not been paid for it. Keep quiet. Don't use your voice. Some of our singers, especially professional singers who come, don't use your voice, or professional voice users. And finally, warm up and cool down the body. Very important to, as much as you're warming up, also cool down, right? So, body exercises are simple stretches that you can use. Breathing low, we talked about it. Breathing, taking nice deep breaths low, and maybe counting out and using an F and coming out on that. Your NG siren, using the NG. For example, say the word sing, and you can all try this. You don't have to turn on your microphones. You can all try this where you are. Using the word sing, just hold on to the NG. For example, sing. I don't know if you could hear me, but I was using the NG. Now, I am a singer, so my range is more. You don't have to use it to expand so much. You can use it within your modal range or your speaking range. So it could just be sing, up and down, right? And that's good enough. We spoke about semi-occluded vocal tract exercises, SOVTE, which is again straw phonation. This was started by Dr. Ingo Titsi many years ago, early 2000s. Put your straw in. You can even sing whole songs. For example, Happy Birthday. You see, you just keep going with your songs as well. That's great. Using v, like a V, you have to feel the pressure. Singing your whole songs with V, or singing scales with V. These are all semi-occluded, and there are plenty. I've just shown you one. Lip trills, you've probably done them. The key is not to do it loud, but to do it softly and gain control. And finally, if you're studying singing, or if you want to be a professional singer, you use targeted exercises, which depends on what kind of song or genre that you're using. I've said, got a question. If you do, you can write to me on Instagram. You can connect with me, any of these places. I'm if I can, I'll definitely reach out and give you an answer if you've got things that you're thinking about. But we have some time right at the end when you can ask other questions as well. So I'm going to stop sharing and invite Tiara Oberoi. She's a professional singer, actor, a professional voice user. She also teaches as well and uses her voice quite a bit. Over to you.
Hello, everybody. Cool. How is everybody doing? I know that this is a lot of info for all of you. And I'm so excited that you all have had the opportunity to hear from such wonderful and learned people, such as Dr. Shantanu and Miss Sandy as well. I think this is a good point in the call to have a water break if you haven't already. Yes, so I'm going to be talking to you about the Performer's Guide and marrying the world of science, if you will, and also acting and singing. As a performer, your voice is three things. You have one of the coolest jobs in the world, guys. Your voice is not only like your talent, it doesn't just exist for that kind of fulfillment, but it is also your tool and it is your trade. all the more reason for you to be taking care of it. Because without this, your storytelling can't happen, right? I have a little activity for you guys, and we'll run through each of these talent, tool, and trade, and how to practically apply it to your life as a performer. But let's talk a bit about your talent now and what it means for your voice to help and amplify your talent. And also, for those of you who are in here thinking you guys are not performers and storytellers, I promise you, you are. We are all storytellers in some way, shape, or form, and this exercise will probably help you and act as a catalyst, give you some exciting things to think about. Here you go. This is a new activity for you. Is there something I can do for you? Your challenge now is to, after you've said this sentence once as yourself, say it as many ways as you can. And you will only stop when you have run out of ways to say it. So I'm going to stop talking for a second, but I'm going to let you crack on and try this exercise. 3, 2, 1, fire away. Okay, I'm seeing some people starting to give me puzzled looks like, what? What was going on there? Now, can you imagine? I saw some of you get really invested. Oh my goodness. I was just ready to just go woomph and start filming you for the next documentary. Like, amazing. Love the commitment, love the facial expressions. I want to ask you though, if I had to take away your voice and I gave you the same activity, how would you do it? Sure, you'd give me lots of facial expressions and a whole lot, and it would still be really convincing. But I want you to recognize the value of your voice as an actor or as a performer. How much load, you've heard that word today, but in different contexts, but how much of a load it actually has, or how much weight your voice actually has in this life that we call performing, right? Let's move on to the next thing. How many stories did you guys tell? Your voices are so cool. I know Miss Sandy said this earlier, right? About how your voice is almost like your fingerprint. It's unique to you. How many stories did you guys tell? You told so many unique stories in the span of what? 1.5 minutes? And some things that you changed. Practically, for those of you in the room who are interested in performing arts, these are some technical things that you change when you approach and you try and tell different stories as an actor or singer performer. You changed maybe the tone, intonation, or pitch. You might have said it a bit higher. Hey, let's go back here. Is there something I can do for you? Oh my gosh, I've gone into Minnie Mouse and Mickey Mouse territory. You might have changed the pace or the tempo. If you were a really tired character, would you go, is there something I can do for you? Probably not. You'd slow it down. Is there something I can do for you? You change the volume, right? If you were an angry, I know we've talked about angry parents and the involvement that has on children today earlier in Miss Sandy's sentence, but if you were an angry parent telling your child, is there something I can do for you? You probably say that louder than softer. You also probably played with emphasis. Is there something I can do for you? Is there something I can do for you? Is there something I can do for you? Right? You also probably played with pausing. Is there something I can do for you? Is there something I can do for you? I just want you guys to recognize, those of you in the room, because I know people have come from different backgrounds. I just want you to recognize that your voice carries all of these tools to make you a storyteller. You have the talent. You are telling stories all the time. So all this advice that we've talked about today is applicable to you as well. Even if you don't find yourself a storyteller, you're always telling stories. Your voice needs the support of all the tools that you learned today. We have talked at length about warm-ups and how you need to go about them, and different tools, different SOVTs, and different ways to do that. We've also talked about cooling down. Dr. Shantanu talked to you about listening and feeling, right? The sensations. Miss Sandy also touched on the 10 points, like your habits. You want to be able to build good, sustainable habits to have a sustainable and long career. And we've also talked about taking breaks and check-ins. We've talked about all of these things, and these are essential for you and your life as a performer in taking care for your voice. Please. I'm just going to quickly tell you from a performer side, in terms of warm-up, you'll note over there I've said physical and vocal. Ideally, as a performer, you want to have about a 15-minute physical warm-up, and I would do that one first, and you'd probably start with stretches, just opening up everything, making sure your blood's flowing, as reaching everything, you're getting some heat in your body, and you're raising your heart rate, right? And once we finished our physical warm-up, we'll start with stretches, and then I would do about 5 to 10 minutes of cardio. Light cardio. Don't go all out, especially right before a performance. You do not want to expend all of your energy on that 5 to 10 minutes of cardio. And especially if you're doing something like musical theater and you have a dance routine or a dance call later in the day, you don't want to have spent all your energy on your warm-up. The next thing is your voice warm-up. We've learned different voice warm-ups that you could do today. I hope you've taken note of that. Please add that to your toolkit because those are super helpful. Starting with the lighter ones first, and then you layer them on. And I would also, as a performer, I have not added this in here, but do an articulation warm-up. You want to be able to make sure that everything that you're saying is clear. So adding an articulation warm-up like some tongue twisters. Peter Piper picked a peck of pickled peppers. And you keep that going over and over again. But doing that once your voice is warmed up. And Miss Sandy said something extremely valuable about vocal load. You do not want to expend all of your energy in that half an hour that you are warming up, especially if you've got to sing big numbers or big things or speak, big Hamlet's monologue in the next half of the day. Cooling down, super important. Your voice is a muscle. You need to relax it. And sometimes when the adrenaline is there after a big show, your voice, everything kind of ends up going really high and your body's really excited and you don't want to stay in this tense place all the time. You want to be able to relax and bring it back down to your where you speak normally. You're not all like this. That's not helpful for you. Listening and feeling. Like Miss Andy said, your voice does not have any pain receptors, right? So the only things you can really rely on are the sensations around. If something starts to feel wrong, don't wait for it to go horribly wrong before you find help. Keep listening and feeling. Habits. You want to be building a good routine. I've written habits here, but ideally your warm-up, your diet, your hydration, everything, it needs to exist as a routine that is just standard for any show that you do, for any audition that you walk into. You want to be able to have a routine that you know works for you. It'll take a bit of trial and error, but what you don't want to do is be doing the trial and error right before your big audition. You want to have everything set. So take this time, especially students, take this time now, your years that you are learning and training, to build everything now. And then, so you have a good solid routine by the time you get yourself into the industry. It is so important to know when to take breaks, when to do check-ins. Check in with your friends if you have performers who are friends. Check in with them. How is their voice doing? Build a little community. The industry, I tell you, can be really isolating. So it's so helpful if you have friends who you can encourage and take care of each other. Let's go to auditions. This is something that's not touched upon too often when we're talking about vocal care. But let's talk about auditions for a second, because actors and performers, we spend a lot of our life auditioning, probably more than we do performing even. And the big ways that auditions happen are self-tapes and live auditions. The industry is changing at the moment, so sometimes you'll get, right now there's a slightly higher ratio of self-tapes and less of live auditions, but there are still live auditions that do happen. So with self-tapes, how are you going to take care of your voice during self-tapes? You are going to pace yourself, okay? If you are somebody that you feel like your voice is quite open and quite ready early in the morning, do your self-tape then. Don't do your self-tape right before bedtime, because remember what we said about routines. Your body gets used to that, those sensations and those routines and those habits. So whenever you feel most comfortable in the day and your voice is its most open and most resonant, that's when you want to be doing your self-tapes. This is such a big one. Do not give yourself more than 3 takes. I know people in this room. I'm seeing people in this room who are habitual offenders. Don't overthink it. your body knows what it's doing. Just trust that you've got all the tools, you've got all the skills, you've built your routine. You'll be fine. It's okay. Don't allow yourself more than 3 takes, because after 3 takes you start to get tired. You also start to get stressed. And when you get stressed, everything starts tensing up, all your muscles, and everything gets more constricted and you get more frustrated, and it doesn't help. Clear consonants. The thing that I said about your warm up for self tapes, especially, and you want to be able to make sure that in your warm up routine, you're tailoring it to what you're doing. So if you're doing a self tape, you might have more consonants, and recognize that you're speaking to a camera. You don't have to speak that loudly, the camera will pick up. But what you do need to do is be careful that in speaking quietly, your words are not getting lost. So that's where you want to have warm ups that, help with the articulation, clear consonants. With live auditions, take a moment to take in the space. Sometimes you get auditions in really big, echoey rooms. Sometimes you get auditions in really, really tight, closed spaces. Take a moment to plant yourself in there, see how things are going, and just gather your thoughts. And especially when you're doing a live audition, because there's like a producer, a director, other casting directors sitting in front of you, your breath might go, ooh, and your heart rate might go like a bit wild. So you want to be able to take a minute to slow down and get everything, all your nerves under control, so that you don't end up shouting. Because in our excitement, sometimes we shout and we push. So you want to be able to ground yourself, and in grounding yourself, you will take care of your voice. Raising your soft palate. So if all of you take your tongue and you just trace across the roof of your mouth and go back to that little squidgy bit, right, somewhere here. That is your soft palate. You want to be able to raise your soft palate, and that will help you project your voice. Instead of pushing from down here. Miss Andy also said something about twang resonance. That is a great thing to explore if you want a sustainable and long career in performing arts. Let's talk quickly about your trade. If your tool is damaged, you won't be able to open the shop, right? So you guys need to know when to say no. There will be certain opportunities that come your way that seem really exciting, and feel like it's going to get your career ahead. But if your voice is not in a safe place to be able to take that load, do not take it. You need to know when to say no. Cool. The second point, actors often spend their voice in the wrong places. Your voice is your currency. If you have a big audition the next day, you should not be caught eating pizza the night before. Why? Acid reflux. It's not going to help you. If your audition is on Tuesday morning at 7 a.m., we shouldn't catch you with a pizza at 10 p.m. the previous night. We also shouldn't catch you at a birthday party, right? Because you would have spent a lot of your voice the night before. Also should be sleeping to make up for the rest and the recovery. So your voice is your currency. Use it wisely. Every tradesman has a specialist they call when a tool breaks. Don't wait for a problem to come up. If you are sensing and hearing that something is wrong with your voice, or your community, your friends and your teachers are telling you, go find someone to help. And on this point, actually, on trade, I've not listed it here, but if you have the opportunity and the access to training, I would say do it. Keep training your voice. I'm in the industry now, but I keep getting lessons and I keep training as well, because this is a muscle. You want to keep exercising it. It's like going to the gym, right? It's a constant thing. You just keep doing it to build strength. So we've talked a lot today about different things, and I just basically summarized it. But if you have any questions about the industry, you want to get in touch, you also might want details. So for performers specifically, we're doing a workshop in the month of May, and the details will be up on on Harmony the Music School social media and on the website within the next couple of days. So you can have a look and see if that's something for you. But if you want more details on that, you're welcome to write to me as well. And yeah, if you need support in any way, shape, or form about navigating voice problems as a practicing singer in the industry, I'm here to help.
We had one question, so we'll just take two or maybe three questions very quickly. And I've answered this already in the chat. Hi, ma'am. I used to be a very good singer, but after some years I got very busy and I have not sung for over 4 to 5 years now. Every time I sing, I feel very strained and my throat hurts and feels like someone's physically suffocating me. How do I work on this? Number one, the easiest thing that I would say, we tend to think that, before I used to do this, that, and the other, but why can't I do it now? What's changed? Unfortunately, remember what we talked about. If you've not been using it, you lose it. So if your muscles are not used to something, you tend to overuse and push it when you're trying to, you look back and say, well, I used to, but why can't I now? So we tend to push. So my advice would be to first start off by being really slow and build capacity in your voice little by little by little, and slowly, it's almost like stretching it a little more today, a little more tomorrow, maybe next week, building slowly rather than trying to sing probably some of the songs that you did before and assuming that that's going to take you anywhere. So it's very likely that it's because of straining. You're trying to do what you did before, and that's why you're feeling all of this. So if even after this, and you probably do voice lessons or whatever, and you still have problems, then you'll have to go and get yourself checked. Dr. Shantanu, are you on call?
Yes,
Yep.
yes, I'm there.
Do you want to add to what I've said?
No, I think that pretty much sums it up. So with what also happens, so I don't know the ages that we're talking about, but unfortunately, with time, things change. Our physiology changes, and over a period of time, you can also develop a little bit of vocal cord scarring. And it's simple as this: a 20-year-old Sachin Tendulkar or Roger Federer was very different from a 40-year-old one. That doesn't mean that they can't do what they want to do. It just means that they have to have reasonable expectations and gradually work to it. So you restart and take baby steps. Don't think that you're going to be doing what you did right away.
Absolutely. And I think she has answered us saying, that is true. I used to push, wishing I could reach what I used to before. Thank you. Well, see, it's almost like we know, right? This is what happens. We tend to live in our former selves. Does anybody else, but I encourage you, keep singing. Don't stop singing. Keep singing. Does anyone else have a question, a burning question that you need answered? When I do straw phonation, my voice has a lot of flips at times, not always though. And when I go high, it feels strained. And I used to be able to do all of this very comfortably, but I fell sick in January, and since then my voice has downgraded. I let Dr. Shantanu answer this first, and then I can possibly add in, or Tia can add in.
The long and short of it is, whenever we get sick, and often we're talking about I'm guessing you're talking about like a respiratory infection, or you're talking about a little bit of laryngitis, you're talking about a common cold. So, in all of these scenarios, again, unfortunately, there's a lot of dehydration. Plus, there is a lot of meds that we take which also cause dehydration. With regards to vocal strain, see, vocal strain is something that we see in singers pretty much all the time. The goal would be to not have any vocal strain at all. And that comes with a lot of discipline and gradually increasing your vocal range rather than expecting that you would. Now, rock artists, they kind of wear the vocal strain as a badge of honor when they're performing. They can constantly see their neck muscles. But effectively, for somebody who's teaching music the way it should be taught, like Sandra or Tia would, the goal would be to not use the external muscles of the neck, which is what we end up doing when we're trying to go out of our fundamental frequency and or our most convenient range. So the fact that you're having vocal strain or neck strain just means that you need to slow down and maybe spend a little longer to get to that. It's not something that you can't do. It's just something that needs probably a little longer. And if you keep on trying with the same methodology, chances are that you are going to cause some amount of phonotrauma, some amount of vocal fold scarring, which you don't want.
Absolutely. Thank you for that answer. I'm just going to add a little bit to what Dr. Tandon said, because you have brought up, I think it's Sarah who's asked this question. You have asked about specifically using straw phonation. I don't know how you're doing it, but it also depends on how much water you have in your cup and how thick your straw is. Sometimes we would change this. So try, and also while you're doing it, don't push, don't over, try to push too much. So when you put your straw in, I've got a paper straw here, see if you can gently press. If you're able to gently press it to increase something called the backflow, which happens when we do an SOVTE exercise, or semi-occluded vocal tract exercise. What that simply means is, for those of you who are geeks, here, bio geeks, and you want to know the inside, the supraglottic, which is the pressure above the glottis or the space in your vocal folds, and the subglottic pressure is sort of balanced. That creates a cushioning effect around the vocal folds, and you're just changing that ever so slightly by pressing, which means you're increasing or decreasing, right, the pressure from that's flowing back. So try that and see, but whatever you do, please don't push.
Yep.
Did I
Are
see
there any additional
additional
precautions
precautions?
that Western classical singers should take with respect to amplification and resonance in order to avoid vocal trauma that may arise from not using it?
I will just very quickly answer this. Some of the issues that I've seen, particularly with Western classical singers, is something called a pharyngeal squeeze. That kind of a squeeze. You squeeze the pharyngeal wall, which you don't want to do, because you think that the squeeze in the pharynx will give you the resonance that you're looking for, the operatic sound or the operatic resonance. So I think being aware that you need to have no constriction when you sing. So how do you know that you've got constriction? For example, if you're seated at a table and you pretend that you're kind of lifting it, or pretending how you lift weights, that kind of closed feeling, that's the false vocal folds closing in on your true vocal folds. We have two kinds of vocal folds, false and true vocal folds, and the true vocal folds are what we use when we sing. So this particular issue with a lot of Western classical singers, they try to do the pharyngeal squeeze and get the false vocal folds as well involved in the process of making sound. So you want to feel, I asked you to feel what constriction feels like and feel what it doesn't feel like. So how do we know what it doesn't feel like? Pretend you're doing a silent laugh, like a silent laugh. Everybody try that. Silently laugh. That removes the constriction from your vocal folds. Not just smile. I never said smile. You're laughing from inside. Silent laugh. It's quiet, right? So thinking from that space and building resonance from that space is really helpful. There's one more question that's come in. I'm an Indian classical performer for 15 years. I'm from Pandit Jasraj ji ka gharana. My Guruji always was saying, but the hours of practice, is that only after proper warm up, or is this are these hours of practice good for vocals if we do proper warm up? Whenever I do after warm is so soothing for me. Dr. Shantanu, maybe you can address this. How long, people need to warm up as Indian classical singers, because you've seen both kinds of singers, or you've seen several different kinds. And then Tia, maybe you can also.
Yeah, so the good thing with Hindustani classical music or Carnatic music is that doing riyaz is a very important part of the whole process. They don't often jump in, and it's something which they do. But I don't think that there is a very well-defined amount that of warm-up that one needs to do. But more often than not, a 10 to 15-minute session where they can run through various simple exercises, lip drills, and just basically loosen up the muscles of the pharynx, of the palate, etc., as well as improve the breathing process a little bit before they actually get into a more structured session. I think that's usually enough. And but the challenge is when you're doing it as a professional, you're going to be singing a lot, and in those kind of settings, unless you're doing a stage performance, it's always a good idea to take breaks, because there's only so much that the vocal cords or the lungs are going to take. And the minute you start tiring out, you're going to end up using the wrong set of musculature. You're going to take shortcuts. So not only do you want to take a 10-15 minute warm-up session, and it's not realistic to expect people to do more than that, because that's where you tell them to do maybe 30 minutes and chances are that they're not going to do it at all. So so it's probably a good idea to do 15 minutes, but if you're, say, singing for 2 hours, 3 hours non-stop, please take breaks, effectively take water breaks.
Thank you. That's very useful to hear, especially with, and I know when I've had people singing Indian classical music, or even pop music for that matter, there's a lot of heavy singing, and sometimes at the extremes of your range. So you're using something called your mode one voice or your chest voice. The chest voice. You're using a lot of that, and sometimes singing just in that space can be heavy. So even if you're singing a particular style, it's great sometimes to borrow from other styles and use exercises that help build capacity in the style that you're used to singing or in the style that you want to sing. Because every style, and it's not true, if somebody has told you classical music is the gold standard of training, and that is, if you sing classical music you can sing any style, that is simply not true. Because vocally speaking, sometimes if you're singing for example Western classical music and you're doing pop singing, it's a different gear, to put it in a simple a simple way to understand. It's a different gear you're using, so you can't drive on first gear trying to reach 60-70 speed limit, right? It's different. You have to change gears. And so that's how it works even with the voice. However, there are certain things we do in certain styles of singing that can inform the style that we're used to or that we want to sing. And as I said to you in my talk, finding what your voice is so important, rather than imitating somebody or trying to sing like someone else. Oh, I want to sound like Taylor Swift, I want to sound like Justin Bieber, I want to sound like X, Y, and Z. Sound like yourself. See what your voice is, and that is really, really important. Don't assume that, oh, my voice is hoarse, I must have a nodule, or it's, isn't it? Wouldn't you agree that
Y-
many times people,
yeah, don't panic.
yes, and it can be fixed. A lot of times the issues that we have, they can be fixed, so nothing to worry at all. But please take care. Now that you know, you can't go away from it. Thank you all. See you. Take care. Bye bye. We'd love to hear from you.